I'm Kim Garza. I'm an associate professor in the College of Pharmacy at Auburn, and I use virtual reality in our first-year pharmacy curriculum to help promote empathy for patients who have limitations due to chronic disease. So I do work in trying to change health behaviors, and I realize that in order for people to really change their behavior long term, they need to change their perspective. I envision that you could use virtual reality to change people's perspective if you showed them their future self. So for our student project, we use arthritis simulation gloves. They are intended to simulate the joint stiffness that patients experience with arthritis. The other gloves we have are haptic gloves, so they have haptic technology. And in that way, you can actually feel, when you have the haptic gloves on, the sensation of touching objects in the virtual space. And so our intent is to try to get the haptic gloves to give the sensation of joint stiffness. And in that way, we can use them as a patient education tool. We envision that we could show them the natural progression of disease using virtual reality and haptic gloves. We could also use it to develop empathy for patients in our pharmacy students, and in that way have our students better understand some of the barriers to care that their patients might experience. And so we're hoping that in the future we can expand our activity so that we have a whole catalog of diseases that we can simulate, and students can then go and just choose which disease they want to experience. And it really helps us to show what's possible with using virtual reality in education.